We have many different global health organizations that assist in areas with reduced government fundings. These organizations can be bilateral, which includes using funding from one government to provide resources in another needed area, as well as multilateral organizations that receive funding from many different areas to assist many countries. I'm going to discuss the International Medical Corps, a third area of global health, which is not a government agency. Non-governmental organizations such as this are independent from government influence and in a unique position to address issues not allowed by government. The history and international focus of this organization is amazing. I chose this organization because the passionate roots it's derived from. The mission is simple: to relieve suffering and save lives. They provide this by giving health care training to individuals to enable them to deliver care to the needy. With headquarters in the United States and United Kingdom, the goals are to implement training protocol in underserved communities to teach medical assistance to individuals to make these populations self-reliable. Founded in 1984, it started with Dr. Robert Simon, who was influenced by the 1979 Soviet Union invasion. His passion developed as he witnessed civilians left behind after only 200 of 1,500 physicians were left, as others had either been executed, made to flee the country, or imprisoned. He began his outreach in making trips to Afghanistan to provide basic health care, but soon realized there were far too many people in need. The government had mandates that would not allow his volunteer services to continue, so in 1984 he founded the International Medical Corps. His vision became focused on reconstructing their health care by using the local population with the thought that these select individuals could be trained to deliver care. A full-time Afghan medical training center was set up to train selected civilians for 9 months so they could return with knowledge and given needed medical supplies to serve their community. These supplies would be replenished monthly. It was shown that local citizens with this training could diagnose and treat 75 to 80% of illnesses and injuries encountered. Access to obstetric care is necessary as well. So IMC, International Medical Corps, has added midwifery education as a key focus to receive skilled and life-saving care. Supporting the training for midwives in many countries through pre-service, in-service, and continuing education has had outstanding results in delivering routine and emergent care to these individuals. The International Medical Corps has also begun a new resilience program that integrates nutrition, clean water, hygiene, and primary health care services. They work with local government to deliver these services to schools and community centers where families can be most impacted. This training and community education has significantly reduced child mortality. In Bossolo Sor, mothers in similar economic circumstances were taught to educate others on prevention of malnutrition in their children. They were also taught the benefits of breastfeeding to promote nutrition, as well as the use of mosquito spray to prevent childhood illness and possible mortality. This is another way the International Medical Corps has expanded its services to use locals to model and provide peer-based education. The mission of this organization is without a doubt to relieve suffering and help those hurt by war, national disaster, and disease. They do this by providing vital healthcare services with their primary focus on training individuals to deliver comprehensive care. They want to return these devastated populations to self-reliance, as with these medically trained citizens, to care for these situations. Graduating these medical knowledgeable people provides us life-saving care to 70 countries. In emergency, this organization sends knowledgeable medical professionals to assist in disaster, where they remain to teach medical care skills to the locals. One of the latest events they participated in was a typhoon in November 2013 that affected the Philippines. Responding within 24 hours, after 6 weeks, they reached 20 municipalities and 44 barangays with over 14,000 health consultations. I've enjoyed learning about this organization and this as an agency I would love to work for. I love teaching and having the education to share my knowledge. The thought of going to a training camp to teach these select individuals is something I would volunteer for when time in my life eventually permits. It becomes a medical mission in giving the ability to utilize my experience to assist others in gaining desperately needed knowledge to help their country. Providing locals with these resources and needs can make a huge impact. By teaching someone, the benefits last forever. I remember my father quoting the Chinese proverb, "Give a man a fish and feed him for a day, teach a man to fish and feed him for a lifetime." Besides the teaching, they have respond to deliver care in emergency situation. These committed first responders react quickly, traveling thousands of miles to go assist communities in disasters. This would be a great experience. They have a roster of trained medical professionals that they use for this. It requires a 2 to 8 week commitment and the ability to respond in 72 hours. I would love to consider this in the future with more time to spare. We cannot stop disaster, but we can act to give these vulnerable families tools and education needed to maintain health in these unfortunate circumstances. Thank you.